Good morning and welcome to the Coffee with the Commission, a time where the WMC discusses topical issues that affect you. Today we will be talking about the Practitioner Support Program, also known as PSP. Today I am joined by Micah Matthews, Deputy Executive Director, and Dr. Gina Fino, Medical Consultant with your Washington Medical Commission. Before I turn the webinar over, I would like to take care of a few housekeeping items. We encourage you to ask questions throughout the presentation by using the chat box within the Teams framework, and we'll do our best to address your questions at the end of the presentation. Coffee with the Commissions are structured so that there's plenty of time for questions, so feel free to enter those in at any time in the chat. We are recording this webinar, and it will be available on our website within the next few days. Please feel free to share these resources with your friends and colleagues. So with all of that out of the way, I'm going to turn it over to Micah.
Morning. So we were asked to sort of give an overview of this because it is a newer process. It's about 2 years old. And so just to start off, I'm going to give it an overview of the complaint process. This is very high level, just so everyone understands what the PSP program is attached to as far as a process. Just to start off, anyone can file a complaint with the medical commission about medical care that they receive from a physician or a physician assistant. The medical commission has 21 days to do the intake portion and the assessment process, which means we put it into our system and then we put it in front of commissioners so that they can decide whether to take action on the complaint or not. Their options when they do this is a weekly meeting called Case Management Team or CMT. And so their options are to open and investigate. There's option to open and do what we call an off-ramping, which is where we assign it to a commissioner. They review it and they decide that it was probably opened in error just due to lack of expertise on the CMT panel. And so they have 14 days to send that back to the CMT panel to close it with a memo. And then there's a hold where we don't open it. We have a specialist that is on staff. Maybe there's a urology or OB complaint, and we just don't have the expertise on that CMT panel. So we send it to them to say, is this within the standard that you're aware of? And then they can give us a recommendation to open or close it. Finally, there's the standard close options where a typical form letter would be sent to the licensee letting them know that there was a complaint and it was closed. They're welcome to request more information through public disclosure, and then they can see the complaint that way. And then finally, we can close it with PSP. And so we're going to be using a little bit of acronym soup in this, and so I'll try to remember to define those. So PSP is Practitioner Support Program, WMC is the Washington Medical Commission. And so moving on to what the requirements are on the WMC related to complaints. So number one, we have to assess all the complaints we receive so long as they appear to be within our jurisdiction. Complaints, whether they're open and closed, must be disclosed through public disclosure. And I want to reinforce that. Anybody can go to public disclosure and ask for a copy of a complaint. It might come out redacted, but anybody can get it, including your bank or your insurance company or anybody else. So moving on to the origin of the PSP. So that it was born out of kind of a frustration of what the legal process for complaint processing is defined in law. It's very general. There's not a lot of consideration for individual situations, and the commission just wanted more flexibility. The other piece is we wanted more customized response for complaint and investigation closures, because sometimes just sending the form letter of we didn't find a violation doesn't meet the need of we didn't find a violation, but we think that based off of what we saw, there's something that you can do that could improve your practice. And so the other piece that we really were focusing on was trying to introduce a more human-centered design aspect into the WMC processes. So we wanted to give licensees more access to WMC resources and introduce more positive touch opportunities with the WMC. Finally, the goals of the PSP really are to increase voluntary education for our licensees and to reduce or eliminate repeat complaints. And with that, I'll turn it over to Dr. Fino.
Thanks, Micah. Hi, I'm Gina Fino. As Jimmy mentioned, I'm the medical consultant for the commission. And my role in the practitioner support program is to match an educational opportunity with the PSP closure. So how I do that is I attend the case management team meetings where complaints are closed and practitioner support is recommended. And most often, the commission has identified that if a customer service kind of communication issue is something that would prevent this kind of situation from arising in the future, they will most commonly close a complaint and direct a PSP closure for communication. What I do at that point is I go back and review the complaint and see if there's a specific communication issue that can be addressed. Some of the more common communication issues that the commission identifies relate to implicit bias, biases that practitioners may not know that they have. So a lot of times what the PSP letter does is acknowledge that a complaint was received and an issue that was put forth was a communication issue and a recommendation for looking into an article or a CME continuing medical education opportunity to address the issue at hand. In terms of how this all plays out, I think, Jimmy, if you'll start to advance the slides, I can go through and give. Great. So, thanks. The type of complaints that result in PSP, the example that I just mentioned is communication, but standard of care issues are also come up. And one of the reasons for that is most commonly complaints are based on standard of care issues. Um, Someone alerting the commission that whatever care was provided didn't seem adequate. And in the review process, if there is no harm or no potential harm, but an educational opportunity exists, and this most commonly occurs with management of medical conditions like diabetes, high blood pressure, depression, things that are commonly seen by primary care providers. I can review the situation and identify either an up-to-date, which is actually a resource for clinicians to get information about all kinds of, of medical issues, or a CME course that's available that might address an issue where a little bit of education would go a long way to reducing the complaints that were seen, that were presented to the commission. Um, Sometimes people actually say, I don't feel heard by my provider. And while that might not be a breach of the standard of care, not feeling heard in the context of a medical appointment is never a good feeling. So, how best to bring a practitioner and a patient together so that communication can happen is the most common letter that is sent. And we have several articles, not just addressing implicit bias, but how to deliver information about life-threatening illnesses, how to deliver information to family members about complications in stroke care, all sorts of things that are difficult to communicate, and folks might need a little bit of a refresher on. We have a whole library of issues and how to communicate them that can be offered in the context of a PSP letter. Sometimes people can't get their medical records, or they don't understand why their medical records have things that don't seem relevant and other things that would be relevant are not in there. And the commission actually provides guidance documents that providers may not be aware of. So a practitioner support letter could consist of the closure information, and a link to the Commission's own policies and rules page with a guidance document. The most common one in that situation is how to terminate a patient, and provide continuity of care and give the patient access to their medical records. Let's see. Can we go? I think I'm blending the slides together, so let's see. Yeah. So here we have some other issues that we try to address. Um, Privacy concerns, knowing the commission has a guidance document on protected health information that practitioners may not know about, and so it can be a resource um, that has that can offer a benefit when a complaint is issued about. I don't think my provider really understood um, how to keep that information private. Let's see, what else have I? Telehealth, ethical issues. Sure, as we've are emerging from a, a rapid adoption of telehealth visits to a more hybrid system, we do get a lot of complaints about the use of telehealth and what that means and how that translates into medical care. And so the commission also provides information about best telehealth practices. Okay, next slide. So one of the things to evaluate the success of this program is to look at how many complaints a licensee receives before they have a PSP letter or after a PSP letter is issued. And so this graph shows the number of providers and then how many complaints before. And usually a PSP is offered if multiple complaints in the same instance are received, and multiple usually means two. So if someone complains about a communication issue with a provider, and it may be that the commission looks at that, there isn't an overarching safety issue, and they decide to close the complaint. Several months later, the same provider gets a complaint about a similar issue. The commission may think, gee, maybe that person didn't have an off day. Maybe they could use a resource in patient-centered communication. And then the PSP program would kick in and we would generate that letter with the educational opportunity. And then sometimes practitioners have multiple issues before a PSP letter is issued. And usually what that means is there's a whole lot of different things going on that may or may not be related to, but if there is an issue that's identified, then the commission can offer the educational resource at that point. And the last slide, I think, because this is a new program, we don't have a lot of information on how successful it is. So we are looking though to see if folks receive PSP letters with educational opportunities, if they get complaints again. And so that's what we see here in this slide. And it looks like most of the cases where PSPs are issued are closed before an investigation has occurred. At this point, I think I've kind of given an overview of the kinds of commission is looking to provide for licensees when they're faced with a closed complaint, so that they can avoid maybe having that situation happen again, and they can actually be providing the health care that they want to provide. At this point, I don't have anything to add, so I'll ask Micah and Jimmy if I've forgotten something to give me a gentle reminder. And since this is my first time, kind of let me know what to do next.
So thank you to both of you. I really appreciate that. If the audience has questions, feel free to raise your hand or type that in the chat. While we kind of give people a moment to navigate the team space to do that, do you think you could talk, either one of you, a little bit more about what happens after that letter is received by the licensee? So if I'm the licensee and I get a letter saying, you're a little, we got a complaint. Here are some communication resources. What should I do as the licensee as my next step?
I can speak to that. So most of the time when PSP letters are sent, the folks in the program don't hear back from licensees, but they do occasionally. And one thing that's interesting about this situation is anytime a licensee gets a closure letter, it can be an anxiety producing, and they may call the commission and go, I don't know what this is about. And we can direct them to request a copy of the complaint. But with a PSP closure, with a specific issue that's identified, sometimes respondents will call and say, I'm not sure what this is about, and I don't understand because I think I'm pretty good at communicating, but now I'm not so sure. And what I do is try to kind of help them, walk them through that process in general. And if the commission had identified implicit bias as a concern, explain that biases are things that we all have. Sometimes we don't know what we're doing, and the purpose of sharing that article is to find out. And this isn't meant to be punitive, it's meant to be educational. So, but most times I think providers may take these things in stride. But when it produces um, a reaction, the practitioner's support program tries to respond to the concerns that may be raised. And we do have respondents who call, and one time actually, someone called to thank one of our um, compliance officers, and said they really thought it was helpful to learn about some of the commission's resources. So the numbers are really small, but that's what happens. Usually practitioners may get a letter. We don't know if the information is taken to heart or not, but a very small percentage of them do reach out to the commission and ask for more information.
So I'll just go ahead and say that when the practitioner support program started, the original design was we would send a letter, or we would try and get in contact with the licensee and set up a phone meeting, because along with the human-centered design piece, we wanted to have a medical consultant speaking with the licensee, just to give them an overview of the complaint, the process, and then talk to them about the potential voluntary learning piece. We had to change course on that a little bit, because the response generally was they wanted to know what the complaint was, and the licensee seemed to lose interest quite a bit once they found out what the complaint was about. And so we found that by sending the letter along with the resources first, and allowing the opportunity for the licensees to contact and ask for more support, worked better for them, basically. And Gina, did you want to kind of detail a little bit more about, not everything is eligible to go through the practitioner support program. Are there certain categories of complaints that you want to talk about that are not going to be going through practitioner support?
Sure. Um, Single issues are what the decision makers focus on for the practitioner support program. But when the commission receives reports with allegations of patient harm, a pattern of behavior that is unprofessional or concerning for any kind of misconduct, including sexual misconduct, um, where there are allegations of impairment, and whether there are allegations of violations of state or federal laws. These kinds of allegations are not candidates for receiving a PSP letter with an educational opportunity. Those situations are part of the investigative authorization process that the commission goes through.
And the final one is allegations of discrimination in healthcare. We feel that that's something we need to handle more formally, because it does, as far as using it as a process. We've got a policy on that, on investigating and doing case disposition, legal actions regarding discrimination in healthcare. And the concern really was, we didn't want certain aspects to be able to be swept under the rug or have the appearance of that being that going on by the commission. And we just wanted to make sure that those didn't fall into that category.
Sure. Yes. Thank you.
And while we're on that topic, I did want to let everyone in the audience know that we do have a coffee with the commission coming up on February 5th, specifically talking about how to report discrimination, what that means for the licensee, the person filing the complaint, and how the WMC handles those types of complaints. So if you're interested more into the healthcare discrimination piece of this topic, February 5th, we will be hosting a webinar where you can ask questions, get answers. So go to our website for more information on that. Well, we have no questions, but just kind of as a wrap up, I think one of the things that often happens when you get a letter from WMC, and Dr. Fino, you touched on this, is that there's a bit of anxiety that pops up. And so just, is there any reason for someone who receives a practitioner support letter to be worried or on guard if they give you a call or reach out to the commission for clarification about this complaint and its implications?
No, the spirit of the practitioner support program is really to offer a resource to help licensees continue their medical education, and to give them a tool that can help them with their practice, especially with patient-centered communication. So while anxiety in the situation is completely understandable, it's not necessary. The commission, in initiating and continuing this program, is offering an avenue of support in a way to tap into the lifelong learning aspect of what it means to be a healthcare provider. And the commission is also trying to use this program as a way of understanding the demands of providing healthcare in our current environment. So while anxiety is understandable, it really isn't necessary when that letter comes across someone's desk. It's an opportunity for growth, as kind of hokey as that sounds.
Okay, are there any final thoughts before we log off for the day?
I think just the next steps, what we're planning on doing, just as disclosure, is to try and gather more information, like you saw in the presentation narrated by Dr. Fino, just to understand, is this program having the outcomes that we are hoping for, which is increased education and reduced repeat complaints. So ideally, if someone's getting a practitioner support letter, the assumption that we have is, 80% of people who get a letter from the commission are going to see that header and pay attention to it and take heed and maybe think, all right, this voluntary education is something that we can certainly look at and try and improve our practice, thereby reducing a repeated complaint. So the end goal, trying to reduce discipline overall and get the low-hanging fruit, so to speak. So hopefully in the next few months, we'll be able to get more data and analyze that to see if that's truly being borne out. In the meantime, we've got this flexible resource to give people more education to try and avoid potential negative interactions with the commission in the future.
Well, thank you again for presenting this very valuable information. Thank you for everyone who attended, and I hope you have a wonderful weekend, and remember to take care of yourselves. Thank you again.
Thank you.